Welcome to the show, everyone. Today I've got back Michelle Reittinger. She is the host and author of a book and a podcast called The Upside of Bipolar. We met last year or actually, I think it might have even been a year before, because I think I stopped doing Podmatch for a little while, and I think you were one of the last people that I spoke to. And when I applied to be matched and to be on Michelle's show, my first thought was, and she's been on this show before, so I'll let you know later what the number and the title of that episode was. But I remember thinking, oh God, I don't know if she's going to want me to be on the show because I kind of don't buy into some of these psychological labels. I feel like they're really detrimental to people. They make them not want to change or grow or find out the reason. And of course, come to find out that Michelle's on the same page and it's like, oh yeah, I don't either. And I was diagnosed as bipolar. I'm like, okay, great. We're going to have a great conversation. So today we're back because I have been watching her TikToks and her social media posts, and she's been hitting these myths about bipolar disorder. And I have a little bit of experience in the past with bipolar disorder within the family and other friends. And I have a perspective of like sort of watching and seeing different things that seem to come together to create whatever the expression is. And I know most people want to jump to some kind of label of what's wrong with me, but that often doesn't uncover how it happened in the first place and what the root cause of something is. And as most of you know that have been listening for a while or watching, I'm a root cause kind of gal. Like, I don't want the topical stuff. I want to know what the bottom line is. As far as I'm concerned, we were born sort of perfectly into this world. We chose to be here. We chose our parents. We chose our situation. And somewhere along the lines, the way that we interpret the world and the way that our wounds happened and the way that we cope and the way that we look for love and safety and the way that our nervous system reacts to those things can express in ways that other people think are abnormal, not normal, not okay. And I think that's a detriment to our society. It's what I try to do in The Rewire. What I try to do with showing people many different ways to interpret who you are, how you are, and to make it normal and not weird and not something that's wrong with you. So this conversation is going to dive a little bit deeper into some of those myths that you've been hearing or you have heard, whether you or someone else is affected by bipolar disorder label. But I think I mean, again, I know that this is your area of expertise, Michelle, but I would like to think that some of the things we're going to talk about could apply to a lot of other psychological diagnoses, correct?
Absolutely.
Yeah.
Absolutely.
Well, welcome back to the show, Michelle.
Thank you. I'm so excited to talk to you today. Happy New Year, by the way.
Thank you. Happy New Year. I'm excited well, I think the year of the horse, the fire horse, doesn't kick in till February 17th. So even though I know most of us think it's now, I think it waits. So by the time this airs, it will be before that, and you guys can all get ready to get clarity, and then charge forward with passion and purpose into 2026.
Absolutely.
So let's go over some of those myths. I really loved, unless you want to go back and give people sort of the short synopsis story about your diagnosis, about your experience, about why you're even having a podcast and a book about this.
Yeah, and I can kind of tee up the question that you want to talk about with the way that I talk about this, but I was diagnosed back in 1998, 1 month before I graduated from college, so I'm dating myself here, um, with bipolar disorder. And when I was diagnosed, I believed I was being given an answer to why I was struggling with these increasingly erratic mood swings. Leading up to that, for a couple of years, I had been, going through phases where I would feel really, I call it hypomanic, but just really elevated in my mood. My mind would be racing, have lots of thoughts. I'd have a whole new plan for my life. And then I'd tell everybody, and I'd talk a mile a minute while I was telling everybody all these new plans that I had for my life. And then I would crash and I would get depressed and I would kind of disappear from the world for a couple of weeks. And then I would get ramped up again into a new plan and a new life goal and focus and everything. And my parents were very concerned. They lived in another state and they were worried about what they were seeing because they'd hear from me every day for a couple of weeks and then they wouldn't hear from me for a couple of weeks. And then the next time they heard, I had an entirely different plan. So when I went to the psychiatrist the first time, I was looking for answers. I wanted to know what was going on that was causing me to feel like I didn't have any control over myself. And so when I received the diagnosis, I believed I'd been given an answer. And I proactively sought treatment for like 12 years. I went to every psychiatric appointment, took every drug they gave me. At one point, I was on 7 different medications, and I was not getting better. I was getting worse. And it culminated in 10 years in, I had a breakdown multiple hospitalizations, electroconvulsive therapy, and I started feeling totally hopeless. I started to give up, and I made a few attempts on my life. And I had a couple of experiences that completely changed the way I looked at things. I had young children at the time, a 4-year-old and a almost 2-year-old, and I also had a stepson who was 10 at the time. And I had this realization that if I ever successfully ended my life, I'd ruin the lives of my children. And I knew that their life had value, even though I didn't think mine did. And so I became determined to survive for them. I didn't think that there was anything more that I could hope for out of life other than just surviving because I believed what I'd been told. I believed that bipolar was incurable. It was neurodegenerative. I'd have it for the rest of my life. But I was determined to survive because I thought if I can just survive and give them a chance at having a happy life, then that's what I'll do. But then another hospitalization about a year later led me to the conclusion like nobody's coming to save you. You have got to find a way to do this better. And that started me on the journey to trying to find alternative treatments to, again, what I thought was an incurable condition. But I was trying to find a different way to do this. I was trying to find a better way to treat what I was struggling with. And it actually led to healing, like complete healing and recovery. And when I started trying to share what I had learned with people, I initially I mean, I was looking back at my content for the first couple of years when I started my blog and realized like at that time I still believed it was chronic and incurable, but I believed I'd found a better way to manage it because I was like rarely having symptoms. And when I did, they were very mild. So I just thought I found a way to manage it better. But as I did more research to try and provide better information to people, I started realizing, wait a minute, I think I've been lied to. I had a couple of like pivotal things that happened. One of them, my red pill moment, and I know that term is overused, but it's apt, was when I read Robert Whitaker's Anatomy of an Epidemic. And when I understood the history of psychiatry, how psychotropic drugs were developed, how the diagnoses were developed, like all of those things, I started thinking, wait a minute, like I don't think I've been told the truth about this. And I don't think that I was maliciously lied to. I don't think the practitioners I was seeing knew the truth either. And so that was when I started thinking, I think I'm actually healing. I don't think I'm just managing better. I think I'm actually healing. And I started getting more bold in my words that I used. And then I've been, over the past 2 years, I can absolutely positively say now that I'm completely recovered because I have been through more intense stressors in the past couple of years than probably in my entire life on top of each other, like layered on top of each other. These are all things that would have, any one of them would have put me in the hospital in the past. And I'm like managing and able to function. And I have normal emotional responses to life stressors, but I'm not like becoming catatonic. I'm not, going into depression, not being able to get out of bed. I'm not getting, hypomanic. I'm just living my life. And so when I started sharing this information with people, one of the biggest barriers to helping them understand that it was possible to heal were the lies that we had been told. These myths that we've been told lead people to believe when they get diagnosed that they've been given an answer. Somebody goes in for a diagnosis and instead of understanding that all they're being told is you have a cluster of symptoms and we're going to categorize that cluster of symptoms as bipolar disorder, they think they've been told bipolar disorder is a chemical imbalance. They think that it's like, one of the things I had multiple doctors tell me was that it was like having diabetes and the medication was like insulin. I was told that it was chronic, that it was incurable, and that it was neurodegenerative. And all of those things lead people to believe that when they are diagnosed with bipolar disorder, an underlying etiology is being identified. And it's not true. The diagnosis itself was developed to describe what they were observing. They didn't ever identify an underlying disease mechanism. They've never been able to. They keep trying to go back retroactively and say, okay, now we have this category we've created. Now let's try and justify it with, they do brain scans, they do all kinds of stuff to try and justify the category. But the problem is that they didn't start with the underlying issue. It's not like diabetes where you can, and I know that there's a lot of even controversy around the diagnosis of diabetes, right? So type 1 diabetes is what I'm referring to when I talk about diabetes, not something that's been developed by lifestyle, but somebody who's born with their body is having dysfunction when it comes to regulating blood sugar. Their body is unable to regulate the blood sugar properly. And they understand like how to treat that using insulin and, sugar, it's not the same thing. In fact, one of the biggest problems that we have with a bipolar diagnosis is that we think everybody who is diagnosed with bipolar is suffering from the same thing, and that's not true. So you could have somebody who's experiencing these symptoms. So somebody is becoming psychotic, and there can be somebody else who's becoming psychotic, and they can both be suffering from totally different things. So one person might be, maybe somebody's developed psychosis because they were smoking marijuana. That's a very common trigger for psychosis now. Or you might have somebody who's developed psychosis because they have untreated trauma that has led to this level of dysregulation where they become psychotic and they start having, hearing voices or seeing things. You can have people that become psychotic from micronutrient insufficiency. Severe micronutrient insufficiency can lead to serious symptoms. There are a number of underlying sources of symptoms that can lead to these symptoms. And when you categorize everybody into the same group, they all think they're suffering from the same thing. So I hope that's where we can start.
Well, you gave some of those myths in there, which we're going to pull out and
Yeah.
highlight one at a time, because I'm sure, when you're like they, like who is they? Well, the
Okay.
ones that made the drugs, yes,
Yeah.
the ones that made the
Well,
drugs, or the
so
doctors that said,
well,
"Here's,
that's
we
one
don't
of
know
the
what to do with that."
well, that's one of the interesting things that's kind of become it's a bit convoluted. When you look at Robert Whitaker's, he does a very thorough job of going through the history of how these diagnoses were developed, how the drugs were developed, and it the diagnoses were created initially for the purpose of medicating. They weren't created by drug companies, but doctors were being offered these drugs by drug companies. Some doctors were helping develop the drugs, but they were trying to figure out how do we decide which medication to give. And so they created diagnoses. The DSM, initial DSM iteration. So that for those who don't know, the DSM is the Diagnostical Statistical Manual. It's what doctors use to identify a diagnosis. And they created that for the purpose of medicating. It wasn't created because we've discovered an underlying etiology. They were trying to figure out which drugs to administer. And so they created diagnoses, and then you can use, then they know, okay, so for somebody who's got this cluster of symptoms, we're going to give this drug. And the drugs were not created by identifying an underlying etiology. The initial psychotropic drugs were found accidentally. They were used for different purposes. So one drug was used to treat some kind, I can't remember right now what the physical condition was. So some people were being treated for some kind of illness. And in the hospital ward, people were standing up and dancing around. It made them really happy. And they thought, oh, that's interesting. Let's give that to people who have melancholia, or what we would now call depression. They had no idea what it was doing to the brain. They had no idea how it was affecting the brain, but they noticed that it affected people this way. So they started treating them that way. That's how these drugs were first, they came up with them. And then they developed theories about why the drugs worked, and then started creating more drugs based on the theories. It's very like it is one of the most unscientific approaches I've ever seen in anything. And I was horrified when I started learning more about how these drugs are developed and how they are tested. It's really disturbing to me. Number one, there's two really big issues. Number one, none of these drugs are tested for longer than 12 weeks. They have no idea. They've never tested these drugs long term. The only tests that have been done, like quote unquote long term, are taking people off the drugs at a rapid pace. And not acknowledging the withdrawal and saying, oh, look, the symptoms come back, so they must work. That's it. That's like what they would call a long-term study, but they have never done any long-term studies on any of these drugs. They were never designed for long-term use, and yet people are on them for 20, 30 years sometimes. And they end up with all kinds of other issues because we don't really understand how these drugs affect the brain and the body. And then the other thing that has never been tested is polypharmacy. There has never been any testing for what happens when you combine these medications. So there is no testing to determine whether it's safe or effective to give somebody 3, 4, or 5 different medications. And yet we're doing it on a regular basis.
We're doing it across the board with all kinds of things. I have a neighbor who she's 82 now, but maybe a year ago I was like, Cindy, how are you? She missed a party or something that I was having. And I said, what happened? She goes, I went to bed on Tuesday and I woke up on Thursday. And I said, what? And she goes, and I feel really, really tired. And I asked her to see her medications, not because I'm a doctor and I told her what to do, but literally she was on like 4 or 5 different heart medications by 2 or 3 different doctors. I said, Cindy, you have to go. We muscle tested them and her body said specifically didn't like some things, but I'm like, I think this is overkill. I don't,
Yeah.
who is monitoring the fact that you're on 5 different heart medications from 2 or 3 different doctors? To me, it's obviously I get excited because I I think I want people to, and I know you want people to, be curious, take responsibility, and ask more questions. Like, learn something, people. Don't
Yeah.
defer to your doctors and to whatever everyone's saying, because half the shit people are telling you is not right anyway. And it's not going to help you long term feel. I mean, I know so many people that are on medication because they feel like they have to be. And they end up, people in their late 80s and 90s end up dying of kidney failure. And it has to do, I'm sure, with the chemicals that they're ingesting every day they think they need. Like, let's talk about blood pressure medication for a second. Like, my dad is on some, and I said, you know why, Dad? Because you need to strengthen your heart. You've
Yeah.
never strengthened your heart. So it gets weaker, and then electrically things change, and then stress wise and diet wise. Like, I look at Dr. William Davis, who's been on the show a million times. He was a cardiologist who then wanted to find answers and now is doing gut health
Yeah.
because he found answers to heart issues through food and the microbiome. But nobody's listening to us. I mean, people are listening to us, but you know what I mean? Like, we're the
Yeah.
quacks. We're the ones who are like searching for real answers to really take all of the different sciences, put them together and come up with a root cause and a healing plan, not
Yeah.
a compensation plan, not a, oh, you're old, or oh, you were stressed, or oh, you were traumatized, or oh, you had emotions that other people couldn't handle. You must be crazy. Here's some medication so you don't get crazy again. When looking at that, most of us fear human expression. And I want to ask you how you like the psychosis piece. That's an interesting, I know that's a clinical thing that I'm sure someone could say this is clearly a psychosis, but aren't there times where people literally just have an emotional expression that might be because they've tipped the scales, because they've repressed for so long, and they have like tweak out because their nervous system has literally been holding on to repressed emotions for so long that they kind of like go to the other side, and then they can come back to the middle once they express and release and allow some of these impulses that we hold back because we get judged, or we are told that it's not normal, or we're told that we're psychotic, or it's an expression of a disease that we have, or a chemical imbalance. I mean, when is it okay? I mean, I've been dealing with, for me, one of the greatest, and total left of center because I miss clean. I've never really done any kind of recreational drugs in my life other than wine and alcohol. But I'm a big fan of psilocybin for all of the research that it's doing to help people with opening parts of their brain. I've seen it happen with clients. I've seen it happen with people whose lives they get back. They've been studying it in Harvard and so many different clinical trials all over the world, not just the United States. And here's something, but because it was once classified as a illegal substance, people are like they're not looking at the reality of what it actually. It's first of all, it's a fucking plant. It comes from, like, it's a mushroom. It comes from the ground. And even though I use an extraction that does have to put through a lab, it has all its components in there. There's nothing added nor taken away except some fiber. But we're looking at, like, that has such a stigma of, yeah, this thing could help heal a lot of brains and could help open up some brain pathways. Oh, but the government said that it was bad for you. You know why they did that? It's like all political. It's all money based. So when we come back to, and I've seen, people, and I've had it myself, where we go through things that get buried deep within ourselves, that if it doesn't get expressed, it manifests in different ways, from disease, from cancer to anxiety, depression. I did a podcast way back in the beginning, 2014, 2015. It was called Understanding Depression. And in most people are overcoming depression. And there were we went through 3 different kinds of depression, and one is chemical, but that's like the least amount. And when we look at like what affects that chemical imbalance, it's gut brain stuff. It's like you're talking about micronutrients. It's the chemical, but it can be fixed. But we're not looking at that. We're just saying, oh, it's a chemical imbalance here. Be on this for the rest of your life, and then have the gut issues and all the metabolic issues that come along with that. And you actually never feel better. You just stay sort of numb to the world when you're on some of these drugs. So the question is, where is the balance? Like when you're working with people and they find you, because again, people that work with you, people that work with me, people that work with Dr. Davis, like they're seekers. They're the ones who know intuitively, innately that there's a better answer than what I've been given. But we're not mainstream because mainstream wants to keep people sick and on medication because that's best for their pocketbook. Like cancer will never be cured because chemotherapy is the biggest moneymaker for Western medicine there is. So they're not looking for a cure, even though they may say they are. They're not looking for a cure. Western medicine anyway. But when you're working with people and we're looking at emotional expression or emotional processing, what's the fine line between saying this is a psychosis versus this is that you're just fucking angry and you've had this trauma and you don't feel safe in the world and you're mad at God and you're literally allowing yourself just to express whatever is inside of you.
Well, usually when people come to me, there's an interesting there's a desire to have hope, but there's also an anxiety and worry about because what usually the symptoms themselves are not as bad as the behaviors that come out of the symptoms. So if somebody is psychotic or getting manic, where they start to lose rational control of themselves and start to act in compulsive ways, spending hundreds of thousands of dollars. I have, people that I've seen that, like getting themselves into hundreds of thousands of dollars of debt. They have no self-control. Psychosis that is where they're losing touch with reality. And that feels very scary to people. And there's a worry that if I try this and I have hope for this, that maybe those things are going to come back and I'm going to make a bigger mess of my life. So that's where people, they want to believe that they can heal and they want to believe that things can get better, but there's a worry that maybe the doctors are right and maybe they are broken and they do need medication for the rest of their lives. So the first thing that we do is talk about becoming a detective in your own life. You are looking with curiosity rather than judgment at the symptoms that you're experiencing. Because when we judge those, and I'm not saying that we're making excuses for bad behavior. And I'm not saying that we are saying it's okay to behave in ways that are destructive to yourself or to other people. But it doesn't help to shame yourself for those things when you're struggling with it, right? And so one of the things we talk about regularly in the group, in my coaching group, is looking at with curiosity over judgment. We are looking with curiosity. Why am I feeling compelled to do that? Why do I go into these rages? Rage is a very common symptom that people struggle with. And it's like a dissociative experience for a lot of people where it's like a hair trigger. So it's, it's not like a thing where you can count to 10 and give yourself a timeout. It's the stimulus happens and the response is automatic and you dissociate. You are no longer in control of yourself. And then you're destroying your life, you're destroying relationships, you're doing tremendous damage to yourself and to other people. And then you look at the damage afterwards and you think, oh my gosh, what did I just do? And I just have no self-control. I shamed myself for years over it. When I started looking at it with curiosity and thinking, why does that happen? I wonder why that happens. Instead of looking at it as a symptom that was outside of my control, looking at it like there's something there, something is going on. And I started understanding I was having a trauma response. And there was micronutrient insufficiency involved. So the neurotransmitters in my brain were not functioning in a healthy way because I was not getting the building blocks. And just really quickly, the 4 building blocks for the neurotransmitters are vitamins, minerals, omega-3s, and amino acids. And if you are insufficient in any of those, it can make your brain is not getting sufficient levels to build. Those are the building blocks of these neurotransmitters, which means they're not functioning in a healthy way. And you end up with symptoms of depression, anxiety, psychosis can even come out of that. And so the first thing that I always do with people, instead of like, let's start and I will have to tell you, I don't do a lot with like mushrooms and natural plants and things like that because the very first line of defense is getting your brain what it needs to function in a healthy way. Like, your food is not providing all of the nutrients your brain needs. So let's get the extra support that we need for your brain to function in a healthy way. And almost without exception, once people start getting that, then all the other things become easier. Like processing trauma, because your emotional responses are getting healthy. And so you're able to actually process trauma. It's interesting. I'm going to little side note on that. Psychotherapists and therapists, used to not treat people that were on medication because they understood that when somebody was on medication, they were not processing emotions normally in a healthy way, I should say. I don't like the word normal, but in a healthy way. So they wouldn't see patients that were on medication. But because the drug companies have completely infiltrated, and I mean that in the most sincere sense, completely infiltrated all of the education for every aspect of psychiatry, psychology, therapy. It is now best practice for therapists to make sure that their patients are on medication if it is indicated by the symptoms. And the problem that that creates is that now you are working with people to try and help them cope rather than heal because they cannot process the emotions in a healthy way. Right. And so one of the things that I see with people as they come off of medications, and we do it it's a very, very slow process. So I want to make sure people don't think, I don't like the medications, I'm going off of them. That is dangerous. Like, do not go cold turkey off your meds. That is a disclaimer I need to make sure is out there so people don't think I'm advocating that. But as they go through this process of what we call cross titration, so their brain is starting to get the micronutrients and the nutrients necessary to heal, and then they're slowly coming off of the medications so that the withdrawal is manageable. They start to experience emotions that have been suppressed for years. And that's one of the things we talk about. Like, okay, what do we do with these emotions now? Because you got to learn how to stay with them. You know, emotions are like a child. I always talk about, like, especially intense emotions are like a toddler. If you try to get them to shut up, they're just going to get louder. And when you push them down, they, like you said, you can end up with physical issues. You can end up with, like, there was in The Body Keeps the Score, he talks about a woman that had serious back issues for years, and it was suppressed trauma. She was going to all kinds of specialists, having all kinds of treatments and everything. Nothing was solving the problem. And once she processed her trauma, all of the symptoms went away. And we can end up with, severe anxiety. One of the saddest things that I see from people when they have really serious anxiety is I'm like, your brain is in fight or flight. What's going on? Like it's responding to some kind of stimulus. Like there's something going on. It thinks you're in danger. So the anxiety is coming up. And some of it can be micronutrient insufficiency, but a lot of times people have unhealed trauma or they have unhealthy thought and behavior patterns that have led to sensing danger where there is none. And so they will have these experiences where they have these symptoms. And because we have pathologized the symptoms by calling it bipolar disorder or anxiety disorder or major depressive disorder, people don't look with curiosity at these symptoms. They judge them as a disorder and feel like a victim and feel helpless to do anything about it. And then you just like, this is just the way I am, and people just need to deal with it. And you become more and more reclusive, and you start to lose your life because you can't handle life because you're getting triggered all the time.
It's why I created my core wound map and do my rewire program. There are two things that are involved on the way that I look at this. Because everyone has trauma. Their traumas might be different. There's what is big T, little t, they call it. But everyone has trauma, because even if you've never had a serious trauma like someone else has, it doesn't matter because it's still your perspective. It's like whatever happened to me, like that was a big deal for me. And that was a big deal for you. And then, we get desensitized when we get traumatized a lot. And so it takes a big thing to like actually move the needle. But we all have trauma and we all have wounds, and most people don't know what they are. And the unfortunate part of the system to me is that people are going, one of my clients who did a couple programs last year. She goes, okay, I just fired my therapist, and because I'm ready for the rewire, because she had a session with her therapist and then came to a group call of mine on my membership. And she said, here's the difference. Therapy made me look at what happened to me, and you made me look at what happened for me. And just the perspective of, what does this mean for me? What is it asking of me? How this is expanding me or growing me, versus let's talk about the problem from the victim perspective. That made her more victimized. That made her feel worse. That didn't give her anything to do about it. It made her feel bad about herself. It made her have shame about herself. But when we look at something different, and that's sort of when we're looking at, there's the understanding of what happened to me, or the understanding about what's going on, the very conscious awareness of, I can see and be an observer, which most people can't be an observer very well because they have too much emotion in their process. But then there's, can I feel the feelings? And to me, that's both our skills. I think we have to understand the why, to understand and see how it fits together. But we also have to understand that processing emotions are not comfortable. They are messy. They're often ugly, and they're always going to make you feel like you're out of control. And that's why most people don't process emotions very well, is because they feel out of control. So they avoid it. So that anxiety that you're talking about is actually a whole bunch of emotion that wants to be processed, that's being pushed back down into the body. Because yes, I'm in fight or flight because I won't allow myself to let go. I won't allow myself to fall apart and to cry or to be afraid or to acknowledge that or to stop using my head versus being in my body. And so for me, when I'm hearing it, like, yeah, it's this taking this curiosity, but also looking at it from the point of view of, do you even understand what's going on? Most of us are taught, like, if it doesn't feel good, don't do it. Yet if we don't understand how our brain, how our circuit wires from the trauma. Most people do not know what their core wounds are. That is one of my biggest pet peeves. It's like, okay, we're going to go heal something in therapy, but I have no idea what beliefs I have about myself and the world that drive this response, drive this interpretation, drive this point of view and behavior. Well, wouldn't you want to know that first? Wouldn't you want to know how your whole world is built based on what you interpreted when you were 0 to 7 about how safe you are in the world or how loved or how to get love? So it is looking at both of our approaches are similar in that it's go back and start asking different questions and start to look at things differently. And then look at also, like, you're approaching it from both the here's the observer of what happened to me and here's how I'm going to process. And do I have the necessary substrates to build the neurotransmitters, to have good health, gut health, to have my brain work optimally? And of course, that's going to be important for anyone emotionally. In my last book, in the Invisible Fitness Formula, there are 5 secrets to release weight and end body shame, but I put them in the order of food first, exercise second, and hormones third. Why? Because if we can get you out of inflammation, if I can get you in producing serotonin through exercise as well as reducing inflammation and get those neurotransmitters and all the epinephrines and all the positive endorphins that you get from exercise, and then we balance your hormones, you may not be an emotional eater. I wait for emotion at the end to take care of the physical body so that then I can say, okay, now we're ready to handle looking at emotions. But if we start with the emotions and not calm the body down, you may be having an out of, an out of balanced hormonal response to something that you think this is emotional, right? Depression, because you have no hormones. Well, if you get some hormones now, how do you feel? Oh, I feel much better. Great. Then it probably isn't an emotional issue. And you were mentioning, the body keeping score, Dr.
Bessel van der Kolk.
Yeah, no. I'm going to give you a different book, another book, Healing Back Pain. So the book Healing Back Pain, Dr. John Sarno, he's passed, but he was a surgeon. He was doing back surgeries. And after 30 or 40 years of doing back surgeries, he wrote a book that basically said your back pain isn't physical. I mean, it is physically expressed. It is a real pain, but it is suppressed rage. Like you're talking about rage. We are not a culture. You know how we express rage? Through politics and sports. That's how, but we don't actually process anything. We just muck it up and get it going. And then because it's an okay place to get really ugly and really mean about politics or about sports, that where we can behave in ways that we would never accept anywhere else because everyone's really fucking angry. Sorry, I've sworn a lot on today's show, but really everyone's really, really angry and really, really scared, and nobody wants to deal with either one of those things. So while because you and I could like keep going on this topic with all the emotional things, I want to go back to, and I want to dial back to the people that are listening to this, whether it be bipolar disorder or another diagnosis. I want you to just focus on the myths now. So here are the myths that you're told that aren't true. And I would apply them, or at least be curious to maybe try to apply them to any other diagnosis so that it's not just about bipolar if that's something that you don't deal with or someone that you love. So what's the first biggest myth about healing bipolar disorder?
That bipolar is a chemical imbalance. And it's interesting that Professor Joanna Moncrief had headed a study that reviewed all of the studies and research and everything over like a 25 year period, looking to see if the chemical imbalance theory had been validated. And they were looking specifically at the chemical imbalance theory for depression, because that's where that started. It was the chemical imbalance theory of depression. And they showed that not only had it not been, it has been completely debunked. Like has never been proven. It has been disproven repeatedly. And in Anatomy of an Epidemic, one of the things that he points out is that in the research that they were doing to try and prove the chemical imbalance theory, they actually showed that not only was there not a chemical imbalance to begin with, but the medications themselves cause a chemical imbalance in the brain.
Definitely.
So the medications dysregulate the brain. They do not regulate it. But it's interesting because this is probably the number one thing that I get the most pushback on. And all I'm doing is just citing research. That's all I'm doing. And doctors if you go on X and you look at this conversation on X, you will get it is the most convoluted arguments that you'll get from doctors. First, they'll say, we never said that. We never said it was a chemical imbalance theory. And then they'll say, well, we did say it was a chemical imbalance theory. And this is how it actually, and it's just like so convoluted. And people on a regular basis will say, well, doctors don't say that. And I will tell them, I was in treatment myself in multiple states across the United States over a 12-year period when I was seeing psychiatrists actively. And I had 8 separate psychiatrists between my my regular doctors and hospitalizations. Every single one of them confirmed this diagnosis, and they all said that it was a chemical imbalance. Every single one of them. So I know that doctors are saying that, and they talk about it in drug advertisements and that kind of thing. And the problem that creates, it justified to me the use of medication, because when I was told it was a chemical imbalance, I also was told that, and along with that, I was told this idea that it was like having diabetes and the medication was like insulin. And my brain wanted to make sense of what was going on. It wanted to make sense of why I was putting these drugs in my body. And it wanted to understand what it was doing. And so when they gave me that explanation, I thought, oh, okay, I guess that makes sense. But I kept having these questions. And the problem that we had, you talked about this a little bit earlier, this idea of experts. We have been so conditioned in our society that you trust the experts. The experts know what they're talking about. And so when you have an issue in a certain area, you go to the expert on that area, right? So, and this is fracturing us significantly because we've decided that the brain is separate from the body and that it functions separate from the body, right? So it completely disconnects us. And the experts are telling us that it's a chemical imbalance and it's like diabetes and the medication's like insulin. And so my brain is thinking, okay, I can accept that. But then I'm thinking, okay, but why do you have to keep trying different medications? Like insulin, you don't have different types of treatment for diabetes. Everybody gets insulin and everybody uses sugar. Like everybody, you know exactly what to do. You can monitor the blood sugar. You have little monitors. You can test it. Where's my test? Like, how do you test for my chemical imbalance? And why do we have to keep trying me on all these different medications? I lost track of the number of medications I used because they kept cycling me through meds. At one point, I was on 7 different medications. I was totally numb. I had no like emotional function. And so it completely breaks down when you start looking at it from a logical standpoint. And there was never any justification for the comparison between diabetes and bipolar. And it's the same thing for all these other disorders. It is not a chemical imbalance. No, you're not fixing the neurotransmitters in your brain with the drugs. You're actually messing them up. And so I kind of covered 2 of them there, but they go together because that's how and the idea of it being like by like diabetes and the medication like insulin was a marketing tool from drug companies. There was never any factual basis for that claim. It was simply used to justify the use of medication. It was just a marketing tool used by drug companies.
Yep. That's, I think the next level of what I'd like people to consider is what is the motivation behind what people choose to do research or tell you, and why is that enough? Like,
do you want to hear something? Sorry. I have had one video banned on TikTok, and all I did in that one was ask about if there might not be some kind of a financial incentive to keep us sick coming from a $20 billion a year psychiatric drug industry. That's the one that got banned. All I was doing was just asking a question, and it got banned. It got a community violation on TikTok just for asking that question.
Well, I'm gonna post this anyway, and if it gets banned, I will edit it and re-upload it. How's that? Let's see. if that happens. Yeah, Dr. Davis and I had to cut out so many things on our podcast because of bots and legal things for him. It's amazing how I kept stopping. Like you guys don't even know out there how many times I had to edit because to me I'm like it's a normal conversation. He's like we can't say that. I'm like what? No,
I
we can't
know.
say this, and this because someone's going to shut us down because we threaten their livelihood by uncovering the motivation why half of these. Yeah, you get it. All right. So we're going to move
Yes.
on from there. So in terms of we've got myth one, it's not a chemical imbalance, and the myth of it's like diabetes and you have to be on drugs for the rest of your life. Okay. What's myth number three?
Myth number three is that it is a chronic, well, and they kind of go together. I use these together, chronic and incurable. So chronic meaning that you're always going to have it, right? It is, we talk about chronic health issues, and this is lumped into that category. And the reason why it's chronic is the medication. I'm not going to take credit for this analogy. Dr. Joseph Witt-Doering, who is a big, he's a psychiatrist who started a taper clinic. He's amazing. If you're not following him, go follow him. But he said with antidepressants specifically, but it goes across the board. When you give somebody an antidepressant, it is like shutting off the fire alarm. All you're doing is trying to stop the symptoms. You are not addressing the fire. You are not addressing what caused the symptoms to occur in the first place. And that's the same thing for people who are suffering from symptoms that lead to a bipolar diagnosis. You are not addressing the underlying issue. So the underlying issue persists. And then you add in all these other issues that are created by the quote unquote side effects. And the reason I'm putting those in scare quotes is because they are not side effects. That is the effect of the drug. They like to call them side effects because it makes us feel better about what the drug is doing. We think, oh, this is not the effect of the drug. This is just a side effect, right? It's not a side effect. It is what the drug does. That is what the drug does. When somebody is gaining weight because they're on an antidepressant, that is not a side effect of the drug. That is the effect of the drug. The drug is making you gain weight. So you've got people that develop a chronic problem because the underlying issue is never addressed. And you have created more issues with the medications that you were doing. So you're not making it better. And I will have people tell me they get very angry when I talk about these things because they'll say things like, this stuff saved my life. Okay, well, if you were in an acute crisis, if somebody is running a fever of 105, yes, we want to get anti-inflammatories in because that is dangerous. You can have brain damage from that acute crisis, right? So maybe somebody is a danger to themselves or others. And you want to give them, I'm okay with drugs short term. Like if somebody is in acute crisis, they are a danger to themselves or others. I am okay with an emergency treatment right then. But that is not the long-term solution. We don't do that long term. You don't give somebody anti-inflammatories for the rest of their lives because they are running persistent fevers. You look for the source of the fever. That is the brain. The body is saying, I am in distress, and the fever is a reaction to that distress. So you look for the source. We need to look for the source. What is causing those things to happen? So it becomes chronic because we're not actually treating the underlying source of the symptoms. The second, the one that tends to go with that is incurable. People get very angry when I say that I've healed, that I've cured my bipolar, because it's incurable. So if I've healed, then I must not have had bipolar. So the pushback that I'll get is I'll have people, number one, will say I'm in remission. You can't be cured. It's incurable. So you must only be in remission, and someday your symptoms are going to come back. And the second pushback is that I must have been misdiagnosed. And so both of those, I will tell you why both of those are totally false. Number one, I'm absolutely positive that I've completely healed because when you have triggers for symptoms, I know I know all the triggers that I had that caused symptoms in the past. I've experienced all of those and way more in the last few years, and I've had no symptoms. I've had normal emotional responses to things. So when something is like really stressful, I get sad or I get stressed, I feel stressed, but I know how to manage that now. But I have not had a single day where I can't get myself out of bed because I'm so depressed. I don't experience, racing thoughts. I don't experience any of the symptoms I used to have that would have been triggered by these severe symptoms. When people say that I was misdiagnosed, I always ask, and I have not one time have I ever received a response to this. I always ask, if I was misdiagnosed, what constitutes an accurate diagnosis? Because the diagnosis is based solely on symptoms. You don't go in and get a blood test. They do not do a spinal tap to test your spinal fluid. They don't do anything like that. There is no biological way to determine if somebody has bipolar. It is based solely on self-reported symptoms. And it is very subjectively observed by the doctor too. And so you can go, there have been some really interesting like investigative journalists who have gone out and like gone to a bunch of different psychiatrists, given them all the same symptoms and gotten different diagnoses from each psychiatrist because it's based solely on symptoms. I was in treatment, actively in treatment for 12 years. And I said, as I mentioned before, 8 different psychiatrists during that time, every single one of them affirmed the diagnosis. The only difference was when I experienced my first psychotic episode, my bipolar diagnosis was changed from bipolar 2 to bipolar 1. That's it. I met all of the criteria. Every single time I went in, I checked all the boxes. I had bipolar disorder based on the definition in the DSM. It is impossible to misdiagnose. You know, people, I don't like hearing them saying it's overdiagnosed. That is so infuriating to me. I don't like the diagnosis at all. I use that language because it is what people understand. But in my program, we do not talk about bipolar disorder. We talk about bipolar symptoms. We talk about the symptoms that led to the diagnosis, and we're looking at the symptoms to identify the source. We're looking at them with curiosity, but we don't talk about bipolar disorder in my program because I think that the diagnosis itself prevents healing. It stops curiosity, leads people to become victims, and it prevents people from knowing that it's possible to recover.
That's what I don't like about it, which is why you and I did a show last year about it was about being diagnosed with symptoms. And okay, so you're not the first person that I've interviewed. I had to go back and look back in, I don't even know what year this was. I've got episode 177 of Women, Men, and Relationships, episode 479 on Fit to Love, Moving Beyond the Diagnosis. There's another woman that I met who wrote a book, and that was the name of her book, Moving Beyond the Diagnosis. And she also was diagnosed with bipolar disorder and then did other things and wrote a book about it. And this was back in, I mean, this was a while ago. This was actually 2019. There you go. All right. So 2019, that is as of this stage, 7 years ago. So 7 years ago, I had this conversation, not quite as intense as you and I are having it, because for many reasons. I think because I had her on my show and I had done a different kind of session with her as a client, and she was referred to me by someone else who'd been on the podcast. But you know, when people, I know I can absolutely feel that the people that are mad, that question you, that want to shame you, it's because in a way they interpret what you're saying is that they have failed if they haven't healed it. And even though that's not what you're saying, you're wanting to give people hope. They're like when I used to teach law of attraction years ago, I mean, teach it now still, but there are people who hadn't necessarily wanted me to teach it to them. So I heard, you're the creator of your own reality. That's an Abraham quote. And that to me was very, very good news. I'm like, great. Well, if I don't like my reality, I can change it. Other people heard that as you've chosen really bad things and you deserve what you've gotten. And that's never what was intended. That is not what was said. That is not what, right? So these people are interpreting things through their own filters, and understanding that as a person, as an observer, is how you're going to start to look at those of you that are listening. If you don't want to heal whatever you have, then you're probably not continuing to listen to this episode, right? Or if you're not curious, you have not made it this far. But we're people who are dedicated to uncovering the root cause of anything and everything, and then looking at what in my power, what in my personal power, physical, emotional, spiritual, mental, chemical, whatever, can I do to fix it or to help it or to grow past it? That is the basis of both Michelle and my platforms. It is not accepting what someone else tells me I am or am not, or that this is how you're going to be. It's saying, nope, I'm going to learn something and I'm going to see if I agree with you, and I'm going to try other things that you haven't tried before. So I know we have one more myth, and then I want you to tell people how to, obviously you can buy her book. You can go to upsideofbipolar.com. She's got a podcast, but let's go on the fifth myth.
Neurodegenerative. And I want to say, can I say one thing really quick about what you're just saying? I think the other thing is that people get upset about one of the other main reasons why people get upset is that they have created their identity around this diagnosis. There is we award victim status in our society. We reward it. And so when somebody, and I'm not saying this to be mean, it's just true, that when somebody has been given a diagnosis and they believe they're going to have it for the rest of their lives, they start to take ownership of the diagnosis and they start to make it part of who they are. And I hear, and I used to say the same thing. I used to say I am bipolar. And I hear people say that all the time. They will say they're neurodivergent, and so if I'm telling them you can heal this, that is threatening their sense of self. It is threatening who they feel like they are. And I have a lot of compassion for it, truly. I do. I don't get angry. I don't get offended. If somebody starts really attacking me, I'll block them. Like I just don't have energy for that. But I totally understand where they're coming from, that they've had to work to accept this reality that they have, and it's become part of who they are. But I'm always hopeful that at some point they'll start to question that and start to think, maybe I don't want to live like this for the rest of my life. Maybe I don't want to be a victim to this. And so I try to keep open to these people so that maybe I might be able to help them later. But
Wait, before you get
oh
to the fifth one,
yeah,
because
yeah,
I
yeah.
don't, I think we recorded this and didn't publish this. I had an example, and I don't know if I said it on the very first podcast that you and I ever did together. Now this time it's been four, so um, I'm losing track. But I had a client when I was a personal trainer a long time ago, and her husband weighed on her hand and foot. She was disabled. She was very, very obese, and then her son purchased a package with me to train her. And so I worked with her for a really long time, and I'm a really good problem solver. I'm going to come at it from like, what will you do? Like, what little thing, what little way can we move the needle on whatever you're doing? And she did buy like a Pilates machine and stuff. But it was months and months of realizing that why would she want to get better? If she got better, her husband would no longer wait on her hand and foot. She wouldn't be the queen of the house. Her son would stop buying things for her and would not be so attentive to her every single need every day. She's sitting pretty. She does not. Now, consciously, she'd say, of course, I want to heal. I'm uncomfortable. I have pain. I don't like not doing anything. But if you looked at it from an observer perspective, it's like, oh, no, no, you're getting treated so well. And that just is to go to say with the victim mentality, you don't even know that you're doing it. But it's like when you walk into a room and someone says, oh, I have cancer, or I have this. And someone goes, oh my God, like it's the fastest path to love and attention. Why would anyone give that up?
Yeah.
Right. So it does take, I mean, there's a cost of healing for many people because they
Yeah.
have people around them in their families who have compensated, who like have created these patterns, right, if you will, that are based on your inability to either show up or take care of yourself, and then you get love and attention for it, or you don't have to follow through with something because you get a pat on the back. Oh no, it's okay, you're ADD or you're ADHD, we won't expect you to grow because your brain
Yeah.
somehow, which is all BS too. So anyway, I just want to put that in there because it's another example of you or your family or someone you know may not really want to heal. They may tell you that you do, but if you take another step back and look at the dynamics of the relationships and the things that you benefit from or they benefit from in order of staying sick and staying disabled and staying whatever, versus what is the effort or what it would look like on the other side if they were quote unquote heal. No judgment, stay in your victim. Most likely, most of you aren't because you're listening to the show. But if you have someone in your life who is staying in victim and they refuse to take any responsibility for that, it's because they're afraid of what's going to happen on the other side of healing. They're going to lose a lot more than they think they're going to gain. And so
Yeah.
let them be. Don't try. Like, please don't send this podcast to anyone who isn't curious. Even you may want to shove it down their throat, but you need to ask permission before you share it because they're not open to hearing. And if they're not open to hearing it, then they're not going to change. So,
Yeah.
with that said,
Yeah.
now let's move to the fifth myth
Yes.
about bipolar.
Yeah. Neurodegenerative. And this idea of bipolar being neurodegenerative comes from the medication. When somebody is We've got this issue that starts with symptoms and they don't identify the source of the symptoms. They start treating it with psychotropic drugs. And we have not tested these drugs for long-term use. There's been zero curiosity or zero motivation even to find out what these things do long-term. In fact, there is motivation not to find those things out. It is not required by the FDA to know what the long-term effects of these medications are. And it could hurt the drug companies if they actually got curious about like what does this stuff do to people long term. And there's a tremendous amount of denial about the long term effects of these medications. But people will develop things like akathisia, where you're like this, you're uncontrollable body movements, and and loss of cognitive ability. There's people develop issues with sleep. There's all kinds of things that come out of this. They develop physical problems that are the result of the medications, and it causes people's mental capacity to decline over time. And so the problem is that because we are not willing to identify the source of that as the drug, it gets blamed on the quote unquote disorder. And so people on a regular basis will say that bipolar is neurodegenerative, and it is not, because bipolar isn't an underlying etiology. In order to say bipolar is neurodegenerative, you would have to be identifying some kind of an underlying etiology, some kind of underlying disease mechanism causing bipolar, and you haven't. You have just identified symptoms. The thing that makes it neurodegenerative is the medication itself. The medication itself damages the brain and causes cognitive decline. And so it's so frustrating for me that there is no acknowledgement of what that medication is actually doing to the person, because all of these issues are created by the medication themselves. And the reason that bipolar is incurable as it is right now is because of the medication. That the treatment is preventing the cure. The treatment prevents people from healing. And so all of these things are resolvable. You can resolve the underlying sources of symptoms. Very rarely would somebody come, I can't say absolutely never would there be somebody who couldn't resolve the source of the symptoms, but I haven't found one yet. I haven't found somebody yet that we couldn't identify. I ask people, tell me your story. When they come to me, the very first thing I will ask them is to tell me their story. And I don't want their story of diagnosis. I want to know their story that led to the diagnosis. And I ask them questions because there are main underlying sources of symptoms that you can, without exception. I have never had somebody come to me that didn't have at least 3 or 4 of these underlying sources of symptoms. And so I'll ask them to tell me their story. I will ask them questions. If they're not supplying certain pieces of information, I'll say, okay, I don't need you to tell me the details, but do you have unhealed trauma in your past? I don't need to know the details, but, and I'll ask them, like, do you have these things? And without exception, they've got 3 or 4 underlying sources of symptoms. And I'm like, well, now we know why you have these symptoms, so let's get to work.
Uh, so yes, I'm excited for someone who is ready to do this differently, to hear this, to hear from you, to hear these myths, to maybe share it with someone who is also looking, who is ready. And I'm going to say it's probably not like a large percentage of, if there's 10 people in a room, maybe one of them, 2 of them might be actually curious to explore, understand. And I only say that because of the bell curve of consciousness, of, of looking at sort of the world and how we respond to things and the anatomy of an epidemic and how easy it is to scare everybody into making bad choices that they have not researched or things that they once said they would never do. But someone else says boo and they go, okay, I'll jump as high as you want me to jump because I'm not willing to research anything or to learn anything or to ask questions or to see, again, the bottom line of, well, what motivates someone to do this, create this? What's the story behind this? Doug and I were talking on the way back this weekend about a little bit about political things, and because we really don't do politics. And I said, look, the only area in which I actually have really strong beliefs, opinions, experiences is Western medicine and in the medical industry, because I've been in it for a very long time. So I see what's happening. I understand pharmaceuticals' role. I understand they don't have interest in making things better or really finding cures. Our food's full of shit and nobody cares. Why? Because people make money from it. So, right, people aren't asking those questions. So the ones that aren't asking the questions would think, well, no one would ever do that to me. Oh, really? They wouldn't, right? They don't want to believe that. So they don't look. They don't look at things that we're finding out that happened during and after the pandemic. And they're like, oh, that's old news. I'm like, no, that's news that you all said didn't exist. And here it is existing. So bottom line for this podcast, because I know we're talking about bipolar disorder, but this to me applies to anyone with any kind of disease or even autoimmune diseases. Autoimmunes can be repaired, but most people think, you're told they can't be, just like diabetes. And I'd even say there are people out there who are also reversing type 1 diabetes. Maybe that's not mainstream and maybe it's not the majority of people, but there are people doing it. So why not find some evidence, look for testimonials of people doing something that you want to do instead of listening to a massive amount of people who are saying it can't be done. I'm sure somebody out there is doing it. Find them. research it and look at it if it's something that you really want. Don't take anybody's word. Don't take my word. Don't take Michelle's word. Take your own inner being's idea of what feels good. And here's a hint. If you feel better when you hear it, that's the truth. When you don't feel better, when you feel icky, when you feel disconnected, that's not a truth. That's a lie. So truth feels better and it feels lighter than a lie does. So looking at where would you send people, Michelle, if they're interested in learning more about working with you or referring to you or buying your book?
Yeah, go to my website, theupsideofbipolar.com, and there's links to my podcast, to my book. There's a free resource that I would encourage people to explore. It's called the Mood Cycle Survival Guide on there, and that's a great place to start if you're ready to start like working on this and kind of explore what working with me would look like, because it's that's a free resource that has a written portion for you to to work on, and there's videos for me explaining each of the steps to developing that resource for yourself. And there are some blog posts on there, but that's the best place to go. Everything is housed in there. All my social media links are there, so that's a great place to start.
And whether you are someone who's directly affected by this or not, and if it's something that you support or believe in, definitely follow Michelle and like her posts and share them, because she's fighting an uphill battle of a lot of people that want to keep people sick and on medication and thinking that they can't be healed. There are many of us out there that are trying to be the light for those that are searching for a different path, but there are still a majority that has an interest in keeping us quiet and not sharing things we learn or giving you tools that would help you no longer need their services. So with that said, I wish everyone a wonderful 2026 so far. No matter what you're doing, please follow Michelle, listen to her podcast, buy her book, follow her on social media. Michelle, thank you so much again for another exciting and fun, for me, truthful, hopeful, inspiring, action packed, you can heal episode.
Awesome. Thank you so much for having me.